Ladies and gentlemen, we are coming to our final conclusion, and I'm very pleased to invite to our next speaker, Dr. Mohammed Cartan, who is a medical professional who is now working as a licensed physician at Tolo Hospital, Helsinki Medical University. Welcome, Dr. Cartan.
I am orthopedic and traumatology resident in Helsinki Medical University, working in Tolo Hospital. I just came over here from the operation theater to share with you a little bit my point of view, the situation in Somalia and my trip in Somalia as well. First, if we emphasize the instability in Somalia, I'm not a politician, but I just want to shortly, in my point of view, briefly, explain the way I see the problem which exists in Somalia. Large-scale problems of Somalia cannot be addressed without first improving the underlying causes. In some cases, in some countries, there is ethnicity, linguistic, or religious heterogeneity are typically viewed as a conducive to instability. But in Somalia, we usually don't have any ethnicity or linguistic or religious heterogeneity. We have the same ethnicity, same language, and 100% or nearly 100% same religion. Of course, there is economic dependency, which created turmoil, either from foreign aid or other resources or NGO agencies, which can cause sometimes ethnic instability. Foreign investment also cause ethnic instability for favoring a particular group. Causes of instability as well, if we continue, migration of skilled professionals after the collapse of central Somali state, it has caused that most well-educated people left the country, and there was no any functioning universities or any other institutions nearly or more than 20 years. So that has caused a gap of knowledge, and it's a brain drain which has affected every institution in Somalia. Migration of skilled healthcare professionals directly affected the health system, and in consequence also affected population health outcomes and health workers remaining in the country. The number of doctors or nurses or other healthcare professionals, those are in Somalia, they don't have the luxury of consultation with other experts in different fields. You might have in Somalia only one specialist or some specialties in the medicine. You don't have any professional in that area. Illiteracy is widely perceived as the main cause of prolonged civil war and poverty in Somalia, as long as there was no schooling of the people or public schools that everybody can pay. Then it has caused lots of illiteracy in the country. Somalia now have luckily government, although the functionality of the government is not efficient, just like imperial stage or neonatal stage. To imagine Somalia state needs the know-how of highly skilled professionals, doctors, nurses, engineers, teachers, civil servants, and unbiased politicians. Those have a political qualifications, not politics by interest, or I like to be a politician because of his clan or his tribe, or he likes to be wearing a suit or something, but to know or to be a professional politician. I'm not biased, it's what we're willing to have in the country. If I go into my field, especially in the medical, I'm a surgeon, so what I interest the most is I have been visiting in Somalia in several cities, Somaliland, Hargeisa, Puntland, Garowe. So I have met patients and in order to see what can I help. And the reason why we went there was a project which financed by Finnish Foreign Ministry and was, project was, first received IOM was the International Organization of Migration was coordinating the project, but we Somalian experts or healthcare professionals, nurses, doctors, we promised to contribute our time and know-how to work in a short period or in our summer vacations in Somalia. So I visited Garowe Hospital. This patient, he has a supracondylar humerus fracture. It's somewhere here. If someone is not familiar with that, it's here. So there was a Russian doctor who has taken $500 from him, and he operated, but the wrong way, because nobody asked his qualifications while he was operating him. And after the operation, he had nearly 3 years infections, and he has used antibiotics, nearly 20 different antibiotics, and nearly $3,000 he has spent. This is the X-ray of his humerus bone, and this is a plate with the nails, which has been fixed with nails. But it's just like converted, and it should not be like that. And it was wrong because the one who has done it, nobody has looked at his qualification, as I have said, and actually he doesn't. It was wrong. This young boy, he was 40 years old. He just fell down and he got a fracture of the collarbone. And that fracture, it's very severe. It can protrude from the skin, and then it can cause infection. And in that case, it can be very lethal. And usually in Finland, it's operated in 8 hours or within 24 hours. But there's no know-how, no instrument to use for this operation. And this is the X-ray we have taken from him. This is the worst case I have seen while I was there. A small kid, near 8 years old. He fractured his leg, but his family, they didn't know it was a fracture. They thought it's a kind of insect biting, and it was swollen there. That's what they thought. And they just kept him at home. But then when they came to the hospital, there is no one who could say any other, except that it might be true your insect has bitten. And they went to the city to take X-ray. Now when you see here, this is the packet they put in by the family of the child. And when you see it, every area in his leg, it was swollen, and there's a pus coming everywhere. When I have seen the X-rays, there's a comminuted fracture of the femur bone in the diaphysis area, and there is an infection of the bone which is called osteomyelitis, which is very dangerous, and usually in Finland or in the Western countries, patient stays in hospital nearly 1 month, and he gets intravenous antibiotics. And there's a lot of surveillance afterwards as well. This other small kid, he was 13 years old, fall down, and then he broke what's called a MCL, or medial collateral ligament. It's inside of the knee. There's a ligament which supports the knee to stay straight. It supports from the outside and the inside as well. He could have a small operation and equipment that can be used to fix it. And it takes less than an hour to do it, but there's no equipment available and there's no know-how in that area. When I visit the hospital, that's all the surgery or trauma surgery equipment they have when you go there. It's painful. You cannot work with that environment as a doctor. I have been asked at IOM, because this project has been invested more than 3 million by the Finnish Foreign Ministry. It should not be used to tell this project was intended to help Somalians and Finnish taxpayers' money to be misused NGOs in Helsinki, and it's unacceptable. We have spoken with the ministry, with my Finnish doctor colleagues. I met and spoken with the Finnish Foreign Ministry, but there's no reaction. So that's what exactly happens with the NGOs. They don't do anything. They take the money, and afterwards they write the journals. They know how to edit in a very nice article in the journals and say this money has been spent in the country, and they send several doctors and nurses to Somalia. I came back because I cannot just watch there without doing anything, because here I work. It's unfortunate, especially in Arabian countries where the people are very, loyal and friendly. The money they intended to be well spent fall in the wrong hands. And it's really painful as a doctor to watch such kind of cases. Responsibility in Somalia. Unfortunately, we have not paid enough attention to what unites us, and we tend to do well on what divides us. It's very painful. We have lots of things in common. The country has a lot of resources, longest coastline in Africa, natural resources, petroleum and gas. We have arable land, 2 rivers, good weather. There is a lot of good things that can happen in Somalia. The future is bright, but it needs people to work hard. Everybody's saying, I'll go back to Somalia when it gets better. But someone has to do the first step. As the guy who was before me, what he has done is amazing. Overcoming the current hardships and insecurity requires a determined and long-term effort, persistence, cooperation, and resilience. Essential objective is to have a stronger and more responsible government. Somalia needs to establish loyal and professional security forces with a strong and unified goal, and that's all our responsibility. And we expect the international community to consider the existing problems, and every penny they have given should be well spent. Thank you very much.
Thank you very much, Dr. Mohamud and Cartan, for sharing with your experiences and expertise regarding the role of Nordic Somali diaspora with regard to skills transfer and capacity building in Somalia.